Question number 11, Alastair Scott.
Thank you, Mr Speaker. My question is to the Minister of Health and asks, what updates has he received on the Government's health response to the Kaikōura earthquake?
The Honourable Dr Jonathan Coleman.
Mr Speaker, I'm receiving regular updates and the advice is that the health system is responding well across all affected regions. Our focus continues to be primarily on Kaikōura, and the brand new health centre facility is coping well with increased demand. I'm advised that 12 patients have now been airlifted from Kaikōura to Christchurch as a result of a range of injuries. The Ministry of Health is working well with Canterbury DHB to ensure that local staffing requirements in Kaikōura are met, including the provision from Christchurch of a clinical psychologist, emergency management staff and a health protection officer who will assist with assessments of local water, sewerage and other public health issues. I'd like to acknowledge the outstanding response of the health workforce under trying circumstances and thank them for their work.
Supplementary.
Supplementary question, Alastair Scott.
To the Minister, what other health support and advice is available for anyone affected by yesterday's earthquake?
The Honourable Dr Jonathan Coleman.
Mr Speaker, the Earthquake Support Line and Health Line are available 24/7 to provide support to distressed and anxious people, as well as to give advice on appropriate management of any other health issues or injuries. There's been an increase in calls to both these services. As at 10 a.m. this morning, they had answered 2,690 calls, and at the peak yesterday, they answered 150% more calls than would be normal. We know that this is an anxious time for many, and to help respond to the increased demand, Healthline have rostered on an additional 20 hours of nursing staff today and have staff on call should they be needed, as well as 2 additional mental health professionals who are now on duty.
Question, Mr Speaker.
Supplementary question, the Honourable Annette King.
In light of evidence showing an increased demand for mental health services following a disaster, will he consider increasing mental health funding to districts that have been seriously affected?
The Honourable Dr Jonathan Coleman.
Well, the focus will be on making sure that people in those affected districts have all the resources they need.
Supplementary question, Mr Speaker.
Supplementary question, the Honourable Annette
Can I
King.
take from the Minister's answer that he has said that if the increased resources for mental health services are needed, they will be provided in a timely fashion?
The Honourable Dr
Well, I think
Jonathan
I've already
Coleman.
said that we're making sure that that happens.
Question